And thank you all for taking some time to spend with us. Hopefully over the next 45 minutes to an hour, we will cover a few topics, give you a demo, and answer your questions at the end as best we can. So what we're really going to try to do over the next 40 minutes is a few things. One is really try to work through the definition of big content. For us, we all work with it. It is the volume, variety, and velocity that's kind of rapidly accelerating because more and more information is digital. Second, our world is starting to change inside of most companies, and that is from the content mostly being what we looked at inside our four walls to now paid content that we get from other suppliers like Reed Elsevier and other divisions or other people doing research to what's available out there now on the web, both from your competitors up on their websites, universities, public journals, et cetera. And then that new growing area that we're really trying to mine so we can understand a little bit more of the pulse, and that's social media, where your marketing teams are probably spending a lot of time trying to mine and understand it. What we'll try to do is walk you through a little bit about some of the issues, some alternative ways to solve those issues, and then we'll couch it in two use cases, and then we'll kind of give a short demo of an alternative way that you might want to look at on how to solve those problems. And then again, we'll go back and try to answer what questions you have. So with that, I'll turn it over to Melissa. Melissa, could you give us a little, color on what we're trying to cover today?
Thanks, John. Very quickly, I just want to say thank you and welcome to everyone that's joined us on the webinar. We have a lot of the largest pharma companies in the U.S. on the phone, plus emerging players, some technology companies, and I recognize a lot of the names on the list from having worked with you before. So I think you're really going to enjoy this webinar and get a lot of good information from it. We're all very familiar, as John said, with the challenges of dealing with big content in our industry. Specifically, we have massive information stores continuing to grow with a variety of formats. We have CTDs, we have journals, we have studies, and all kinds of data to support that narrative content. And that content comes from different places, either within your own company, from different departments, generated from marketing through science and discovery, and from outside your company, equally important content to access, especially from the health authority. As that content is generated, there's certainly an impact on the way words are used by who the author is. We have content being developed from around the world, and we have content that's been developed at different points in time. Most of you are familiar with prior to the 1980s, when physicians across the U.S. were encountering patients with unusual infections, indicating that their immune systems were not working, and it was accompanied by unusually aggressive Kaposi sarcoma. We weren't sure what the disease or condition was shaping up to be. But of course, later we were identifying this as HIV/AIDS. But earlier literature doesn't use those words. So we have to be very mindful of words and their use across time when we're trying to accurately access all the content relevant to our current needs. And lastly, there are a lot of tools we're using, and those tools are dependent, again, on a lot of dictionaries, a lot of ontologies, and how each of us and the different sources of content, how we use those tools. So again, it's all about being able to access the right information for the right problem. And of course, there's a lot of risk associated with not being able to access the right information in a timely manner and in a comprehensive or complete manner. On this slide, you see just a few of the areas where we know it's incredibly important to understand with a high level of accuracy what's going on with our products, whether it's in the area of patient safety, in dealing with FDA and other health authorities, or just maintaining a competitive advantage over your competitors. And as we pull that information and monitor our own products, it really goes to the health and welfare of the firms we work for. As you know, your internal information, you're very diligent about using that to maintain your product safety or to develop new products and get those out the door. But you also have to be aware of what's going on outside of you. As FDA issues a new regulation or especially a new guidance, what you thought was a smart plan may have to change. So you have to be able to easily search for and discover the relevant information you need across these sources